Big question is when one of the tricks to use when you explain a method or anything, in fact, in life, you need to answer to the basic questions: when, where, why, how, to whom, by whom, and so on. These universal questions. So now it's a question one: when is BHT behavior therapy not recommended? What are its limits? So I start with the limits. If the patient has very, very severe diseases like cancer, like advanced, bronchitis, asthma, arthritis, or very old age, or obesity or diabetes, any disease which is very complex and very deep in the body, you not have enough power only on the behavior to do the regeneration. In some cases, it may work very good, but usually you need an integrative concept, so like you need more therapies and not only one. Okay, so let's speak about like real possible contraindications. And the question is like pollen-related allergy, and we saw from all the people using behavior all over the world until now, there are let's say like 20, 30 something years, 30 plus years, and no case of allergy to behavior. I don't know. Maybe it has been, but I personally don't know about any case of allergy to behavior. And one of the reasons is because this risk is extremely low, because on this device, which sucks the air from the beehive, the colony, we use a medical grade pollen filter, or we should use, especially for the patients which are already allergic, like Dr. Zorica said from Serbia. If the patient is already allergic to some other things, you must be very cautious with this person. But if you use the pollen filter, then this risk is like 99.99% eliminated. And then we have another possible contraindications: intolerances. So this can be, in some cases, it has been shown, in the case of too much airflow coming from the beehive, too much volume of air coming from the beehive in a short time to the lungs of the patient. This may create some intolerance, like the people, they do not support this. And this is because of a mistake of the therapies, let's say. Some devices, they have this button with which you can regulate the intensity of the air volume. So if they put it too strong, this may be too aggressive for the lungs. And then there is another class of the symptoms, very, very interesting. And we know this from Professor Mamdouh Abdul Rahman from Egypt. These are especially from him and many other natural therapies, transient reactions. Transient reactions or transient symptoms, which are short aggravations of symptoms followed by improvements. For example, cough followed by expectoration. What is happening here? Let me give you this explanation. When the lungs, they are, let's say, more or less full of mucus and the liquid and the smoke and dead cells and maybe microbes and so on. In the beginning, the lungs wants to eliminate this mucus by coughing. But if the cause is still there, weeks, months, and so on, after a certain time, the lungs have not anymore the power to eliminate the mucus. So it's a kind of stasis, a kind of balance, if you want, but it's a negative sense. And when the lungs has the chance to receive the beehive air, then the cells from the bronchia, from the walls of the bronchia, will receive finally substances which are antibacterial, antioxidant, maybe also antiviral, some of them, and which improves the functionality of the bronchia. And then it's like the lungs is feeling, oh, now I've got the power from these substances. Now I can eliminate the mucus. Now I can eliminate the toxins. I can eliminate the gudron from the smoking, for example, and it starts coughing, okay? So coughing is not a bad reaction unless it's a very severe coughing, okay? So if it's a normal or moderate coughing, it is a very good sign. So what to do in this situation? You just break a bit the session. like you say, you allow the patient to cough, of course, you take a few minutes break, and then you give him again the Beehive air, the mask, but not directly on the nose here. You keep it a bit as distance. So they will get the Beehive air in a lower, smaller dose. So step by step, and then after a couple of minutes, when he is breathing normally, then he can keep, or she can keep normally the mask on the nose. Okay, I give you another example with transient reactions from another area. It's when somebody has constipation. For example, somebody has, it's an old person, has the large intestine muscles too weak, has not the power to eliminate the feces from the large intestine. So, and then when you give them honey, honey will give energy to the muscles of the large intestine, and then the large intestine will start to eliminate the feces. And it may go also like diarrhea, like a bit too strong reaction, but it's just because the large intestine wants to clean itself very, very well. So the point is here, when a symptom comes, it should be almost always accepted as a friend. The symptom, it's an indicator which says something is not well in this and this part of the body. So you need to go to the causes of that symptom, not just to stay on the symptom level. And once you know the cause, then you can treat very, very well. Okay, then it's another kind of group of contraindications for Beehive air therapy too. It's age-related contraindications. Like the patients are too old or too young. Too old patients may be too weak to come to the bee house. So in this situation, just to speak about this topic, there is a system, also in Germany, you can hire the Beehive air system. Like you can ask a beekeeper to put a beehive near your house, and then to have the connection, the tubes and so on, and they can come with the Beehive air system, like to suck the air and so on and so on. So you just hire, you say hire, I believe in English, just to buy it for a short period of time until you are healed, then you can give it back. It's like renting the system, like renting a car. Yes. Okay. So if the patient is too old, cannot come to the bee house, or the patient has deeper problems like cancers on various body organs, of course, you should not use Beehive air, or at least you should not use only Beehive air. You need to do the treatment much, much more complex. And then it's the other situation, or the other end of the scale of the life. It's too young patients, like patients less than 2 years, 2 to 3 years of age. It's not because the Beehive air will do some damage for them, but because it's a high risk of complications in case of accidental bee stings. So the bee house must be really like bee proof, like very, very, very tight. So like no single bee should come inside the bee house if we are going to treat children. So it must be very, very attentive because of risk of bee stings. And of course, like from 100 children which are stung by the bees, extremely seldom there are big complications, but it may be. And for a child, it can be like a big drama getting problems like this. And then it's a larger list of contraindications, and this is valid also for all apitherapy. It is what I call legal contraindications, or if you want, it's lawyer-related contraindications. So here it's nothing to do with the Beehive air itself. Beehive air therapy, it's fantastic. It's like 99% okay. But in some patients, let's say very old patients, let's say over 80, 85 or 90 years old, or just very old patients, which are having already in their body cancer, or have had heart infarct, or brain stroke, or advanced diabetes, and so on, they may die. So these people may die naturally because of their age, or because of just their disease, their comorbidities, or their co-infections, like it's named now in COVID time. And they are dying because of these other things and not because of the Beehive air. Okay? But the problem is that sometimes the family is very tricky, and the family says, oh, it's because of your Beehive air, my father or my mother or my family member died. And they hear from lawyers that they can get a lot of money from you. So they ask a lawyer to sue you, to bring you to the court, and saying that you are guilty, that because of you, because of behavioral therapy, the patient died. Okay, so in this situation, what is my advice to all of you is, if you have a very old patient with many comorbidities, you must be very sure that the patient, but also the family members, really respects you. And you should also have this form of consent form that they should sign. The patient should sign, the family member should sign, you as a therapist should sign, but also an assistant of you, which works with you in the same building, let's say, or APRE should sign. So 4 signatures are needed in this consent form for behavioral therapy. But even with this perfect consent form, this waiver, legal waiver if you want, a good lawyer, intelligent lawyer can bring you to the jail. Okay, so best is to have a very good relationship with the family of the patient, to get also the legal consent, this consent form signed. But you may always you must be cautious, because some problems can come in such cases. So what is my advice for you in this situation, like old people and too many diseases? It is better to tell them to use very soft, other soft methods, like a bit of massage, walking, changing the diet, changing the lifestyle, and going to a medical doctor which is trained in AP therapy or behavior therapy, because in this case, the responsibility of the evolution of the patient is in the hands of the doctor. So the doctor said, take propolis, he is responsible in case of some bad reactions came, and not you as a beekeeper or as an AP therapist, as a behavior therapist. Okay, here is another contraindication, the same idea. It's advanced cardiovascular diseases, like atherosclerosis, arteriosclerosis, very advanced, because the people again may die because of this disease. Epilepsy, again, behavior has no problem with the nervous system. It helps the nervous system, it relaxes and so on. But this person having an epilepsy may have a crisis, let's say, next week after the treatment, because of his own disease, and may get a crisis. He may fall on the street or have an accident, or if he's driving the car, he gets a crisis during the driving the car. Sometimes there are patients who says, oh, I'm fine, I can do it. And they get a car crash, an accident. And then the family can say again, oh, it's because of your behavioral therapy. Also, in other groups, psychiatric diseases, not because behavior will not help. It may help even against addictions, but again, it's a legal contraindication or a legal problem coming, because the patient having a psychosis, mania, or depression and so on can take very, very bad decisions, like suicidal decisions, or becoming very, very aggressive, and can come back to you next week and say, oh, my dear friend, I'm breathing so well, but look, I have a knife here and I'd like to put it in your thorax. So with the psychiatric patients, you must be very, very cautious. Okay. So again, as a legal contraindications, and of course in pregnancy, it's the same. Pregnancy is contraindicated for all apitherapy procedures. For vaccines should be also contraindicated, and in many other cases. But again, if all these patients, they are your very good friends, family members, you know them very well, they respect you, they sign the consent form and so on, and they are treated closely by the medical doctors. Or if you work in a big apitherapy center, like they are going to do in Slovenia, then the responsibility of the evolution of the patient is spread on several shoulders, on several people. So you will be, let's say, more relaxed on this. Okay, so this was my short presentation on contraindications. Of course, maybe we'll enlarge this topic in the future when we'll get more feedback from behavioral therapists from all over the world.